So we want to welcome everyone. Thank you so much for joining this informative webinar. So we will share some information about the upcoming mastery program in dental sleep medicine. So this is a very innovative program with a strong curriculum. So the curriculum framework that we have developed for this program. So it's basically designed to fulfill, to fulfill different areas regarding evidence-based clinical practice, the team of speakers. So all of them, they have a very strong academic background, clinical academic background. And, all these all this effort, of course, is it shouldn't be possible without the help, with the support of our local collaborator, as the Hong Kong Dental Sleep Medicine Solutions. So, as our our collaborators or partners in this academic effort, so we want to thank Dr. Jonathan Koo for all the hard work behind all these scenes to do some marketing in Hong Kong and the local area. The same thing with Isaac, Mr. Isaac Sean, for all the support from all these putting together this program. So a few months ago, actually early this year, so we coordinated our symposium. So this symposium, it was very successful. So it was a lot of people who attended, and the interest on learning, the interest of having a more extended program, it was there. Like the participants, they wanted to know what was going to be next. So based on that feedback, so we had put together this mastery program, which is a series of modules where we provide the latest information on the field of dental sleep medicine. So let's go over some slides. We will allow enough time, we will give enough time to answer questions that you may have about the program. And of course, we have the support from the local team, Mr. Isaac Sean, Dr. Jonathan Koo. So there will be always, we all will be always available to answer your questions. So let me share a screen here. Okay, so today I found this new feature on Zoom. So my video will be as part of the slide. So this program, as we see here, is a mastery program. So a mastery program means that the academic framework, the curriculum framework that we include, so it fulfills a very strong evidence-based clinical applicability background. So to make sure that all participants gain the learning about the different areas in the field of dental sleep. But in addition to the didactic component, so the hands-on workshop demonstrations is part of this mastery program. So we believe that having this experience as hands-on to practice during the on-site modules is very important, and this will carry on with the information, the learning that you will apply in your patients. So furthermore, this program, so it really includes the latest or the new advantage in the field of the dental sleep medicine. So we know that dental sleep medicine, so basically is a field in dentistry that include different areas. It's a field that needs a multidisciplinary approach for the management of sleep apnea, snoring. So that's what we are including in this program. But before we get into great detail about the mastery program, so let's review, the reason why we are here and the reason we want to share this learning experience with all of you. So we'll go over these three different areas. And the significance of dental sleep medicine, as we know, is growing. It's a fast growing field worldwide. And we understand that the importance of sleep is there. So we know that we need to sleep. We know that we need to get in specific hours of sleep to be able to perform, to be able to get, all the functions that are needed to develop the daily activities. And even though the dental sleep medicine, we focus into obstructive sleep apnea, oral appliance therapy, it's important to know the other areas, the areas that are needed to get involved to expand the learning. So we include topics related to circadian rhythms, chronobiology. So the team of speakers that are part of this mastery program. So their background is, in clinical area, research, academic. So it's a combination of all these parts. So the effect, as we know, the effect of sleep deprivation, so in the long term, like not having a good night's sleep, not having enough hours of sleep, so there is plenty of evidence showing the risk and the effect on the long term. And even though without developing the condition of obstructive sleep apnea, so we know that the consequences of sleep deprivation is there, and many of these consequences are similar from the one coming from the sleep disorders. So, talking about the sleep disorders, so we can see that the fact that there is a need for education, there is a need for the medical and the dental field to get into action through this particular public health problem. And as you see, the year that we see here, 2006, almost 20 years from this publication. So at that time, there was a big need to create awareness about these conditions, sleep deprivation, sleep disorders. And there was a big call for the medical field to include the teaching and practice of this area in academic institutions. And at the same time, though, when we read this paper, so we can see that the dental field, dentistry, it was also mentioned, it was also advised and recommend to include the same learning in dental settings, in dental schools, and so on. So from there, so we can see new publications, and this one is very important. Why? Because it really shows the prevalence of this condition worldwide. So the global prevalence of obstructive sleep apnea at this time, based on this publication, based on this paper, so the prevalence is estimated in approximately 1 billion, okay, in adult population. So that means that the problem is there, the problem is big, the problem is worldwide, but at the same time, we can see the opportunity to get involved in assessment, screening, and also to be part of the team to offer the different treatment modalities. In dentistry, so we have, different options, different treatment modalities that we can offer to manage sleep apnea patients. Oral appliances, mandibular advancement devices is one of those therapies. But the fact of the matter is that with this learning approach of the mastery program, the different modules, so we can understand that oral appliance, mandibular advancement devices, they are effective. There is plenty of evidence, research papers showing the efficacy of this therapy. And when we combine MADs, when we combine mandibular advancement devices or oral appliances, when we combine them with other treatment modalities, such as positional therapy, myofunctional therapy, sometimes there is a need to combine with CPAP. So the by doing that, we really expand, the scope of treatment modalities, treatment options, and all this effort, of course, it needs to be done in combination with other specialties, with other fields. So we work together, we communicate with the sleep physicians, with ENTs, pulmonologists, or neurologists. So there is a large team to manage this patient, as we see here. So that sound is really it's very strong. It really impacts when we present that video, which basically is the person developing this obstruction of the upper airway, as we see in this animation, the base of the tongue, the soft palate, the uvula. So the upper airway is really comprised of soft tissue. So there are different forces that are going to be involved into the collapsibility of this particular area of the upper airway. So in order to prevent or in order to manage this obstruction, so there are different treatment modalities. So the upper airway, the collapsibility, the pathophysiology of these muscles certainly is related to different causes, as we see here. And this information is something that we go in great detail, about the pathogenesis of obstructive sleep apnea, the phenotypes of obstructive sleep apnea. So based on those characteristics, so we know that there are some patients that will fit into the characteristics for management with a particular treatment modality. Oral appliance is a treatment modality that is really taking a very strong recognition in the medical field. So as we see in this picture, so now, when we review the treatment modalities for sleep apnea patients, so we have in the list CPAP therapy, surgical procedures, different surgical procedures depending on the site of the obstruction, hypoglossal nerve stimulation, commonly known as Inspire, positional therapy, and of course, oral appliance is now included as one of the treatment modalities. So in order to offer this treatment modality of oral appliance, so the dentist it really needs to to spend some time to understand all the different areas of sleep medicine, sleep physiology, and of course, all this is coming from evidence-based dental sleep practice, which is one of the strongest components, though, from our program. So it's a combination, of course, of evidence-based dental sleep practice, clinical expertise. So we include a significant amount of hands-on workshops, so all these, it really shows the need for collaboration, the intersection of dentistry and sleep medicine. And dental sleep medicine, is evolving. It's a field that is evolving very, very fast. And all these decisions, clinical decisions that we made to implement the treatment modalities, so are based, on the current and most updated evidence regarding this field. So the program it really include information, understanding on the existing clinical practice guidelines. So these clinical practice guidelines, it comes from different associations. One of the strongest association that really helps to guide different international guidelines is coming from the American Academy of Sleep Medicine and also the American Academy of Dental Sleep Medicine, which is a collaboration effort to develop these guidelines. So regarding dental sleep medicine, so we know that the area, it focuses on oral appliance therapy, to manage snoring and sleep apnea, but also really expands into different parts, different areas, different conditions that we can identify in dental practice, temporomandibular disorders, orofacial pain, mandibular movement disorders, snoring and sleep apnea, of course. So all these conditions, it seems to be, they are part of the oropharynx, the oral cavity. So as a dentist, we are capable to identify, to screen, to recognize many of these conditions and do the proper assessment and treatment planning, including referrals to other specialties, depending on what we find, depending of the sign and symptoms of these patients. So here, it really include the different areas that are involved in management of sleep breathing disorders, physical therapy, nephrologists, pediatric sleep, of course, very important, dentistry, ENT, and so on. So oral devices, there are so many different designs of oral devices. So the design, the applicability, the efficacy, the research behind each of these design will be included. I see it's included into the teaching and learning of this field. And this is a two-dimensional view, use a simple animation, looking into the soft palate, the position of the hyoid bone, and the way the mandible is going to maintain, the muscles with a better permeability of the upper airway. So along with that, of course, we have convincing CT scans and different imaging that it shows the changes on the airway volume during this therapy. So we'll include all that. We had some specific speakers with the specialty in the field of imaging. So we will include topics and sessions focusing on that part. So talking about and concluding into this part of evidence-based clinical practice. So the papers, the evidence related to efficacy of these devices, has been there. There are different groups in Australia, in America, in Europe, in Asia that really, develop their time, researchers that spend a significant amount of time doing those publications. And at this point, we know and we understand that CPAP as a gold standard is there. And the way that oral appliance therapy, as well as other treatment modalities, it compared to the gold standard. So oral devices, oral appliances, they have some specific indications. So patients with mild to moderate sleep apnea are the best candidate for this therapy. Patients with severe sleep apnea as part of the guidelines. So it's recommended to initiate therapy with CPAP, and if for any reason they cannot tolerate CPAP, I mean, the combination or the use of oral devices is there. So at the same time, so the effect of oral appliance therapy in managing or helping to reduce some of their condition is there. Blood pressure, reduce or management of high blood pressure with oral appliance therapy is one of the newest publications and ongoing publication, ongoing research in this field. So the comparison with the gold standard, as we mentioned, is there, and the overall health outcomes of oral appliance compared to CPAP and other treatment modalities have been published by well-recognized groups in Australia and in some other places. So just moving forward and to take advantage of this session that we have put together for all of you, along with Hong Kong Dental Sleep Solutions, Dr. Jonathan Koo, Mr. Isaac Sean. So let's review the clinical protocol. So this clinical protocol for dental management of sleep apnea, so it's something that we have developed and implemented in different institutions, different universities, dental clinics. So it's a simplified way though, so that you can learn from this program and apply this learning into your existing dental patients. So first, we need to understand the oral appliances, the oral appliance design. So there are many different devices. The ones that we see here are in the category of adjustable mandibular advancement devices. Each of them, it comes with different materials, depending on the manufacturer, depending on the company that is going to help fabricating these devices. So we have devices fabricated with nylon type, material, acrylic, 3D printing. So the program includes an extensive and unbiased review of these different designs. So the component of this protocol that we mentioned and that we implement in this program. So it's listed in here. It started from the screening, continuing to referral and diagnosis, comprehensive examination, understanding appliance therapy, determine the mandibular position, which at the end is the one that it was going to provide the reduction of signs and symptoms and improving the sleep apnea condition. So this therapeutic mandibular position is determined by different methods. And lastly, the side effects, which is something that at some point we all involved in oral appliance therapy. We are going to deal with some side effects. Patient may develop in the short term these effects, may develop the side effects on the long term. So the important part is that we need to learn how to identify, how to manage these side effects, and that is an important component of the mastery program of our program. So the first part goes into the screening, the use of these validated questionnaires, continue into the referral and diagnosis. We need to understand the different levels of sleep studies, including polysomnogram, home sleep apnea test. So there will be some extensive review about what is involved in each of these sleep diagnostic testing, polysomnogram, home sleep apnea test, like the one that we see here. So we'll understand each of these components and also the companies or the equipments available to use in dental practice, to use in sleep laboratories, and how we're going to understand these reports and collaborate with the sleep physicians. So the examination, of course, will include a series of areas, the oropharynx to determine some classification of Friedman classification, Brodsky classification, understanding the need for an assessment of the nose, and to know if this patient may need some further assessment with the ENT. So this is how the collaboration with other areas can continue. So the examination of muscles, temporomandibular joint, is something that it has to be done as a baseline. It has to be done prior, of course, to initiate therapy. Why? Because that will give us some information about possible pre-existing TMD symptoms, something that will help us to determine the oral appliance design, the modifications or the adjustments in the long term, because there is a risk of exacerbating TMD symptoms, which that topic of TMD symptoms is sleep bruxism, so it's part of the mastery program as well. So having completed those first steps of screening, diagnosis, and examination, so now we move into oral appliance selection, determine the mandibular position, which basically is the way that we will initiate therapy, finding a position, a mandibular position that is comfortable to the patient, and at the same time that it is effective, something that is already helping with the snoring, already help with the snoring, or to reduce the apnea severity. There are different methods for bite acquisition, for bite registration. So we will review as part of the hands-on, as part of the workshops, the different options that we have for to identify the mandibular position for the purpose of alleviating the snoring and the obstructive sleep apnea, including the digital workflow. The digital workflow, doing the intraoral scanning to obtain the bar registration and the process to fabricate 3D printing oral devices will be part of the learning process and will be part of the hands-on as well. So this step, it includes the fitting of the devices, to understand comfort, retention, and the design until we reach the therapeutic mandibular position, which is determined by the adjustment of these components. So finally, we know that side effects are going to occur at some point. So we will review, the list, the list of side effects that are needed, the list of side effects that are, that we need to learn, to understand, and the way we're going to apply it into our patients. So the process or the protocol that we need for documentation, so it includes this standard clinical notes, going from subjective, objective assessment and plan of care, which, by the way, so all these, documentations, templates, letters that are needed to communicate with other areas. So this is part of the workshop, part of the documentation designs that we include and that we share with all of you who take our mastery program. So making things a lot easier for the process of documentation, which we know is one component that is extremely important, as part of the management of these patients. So documentation. We understand it's a lot of paperwork, a lot of work behind this step. And we make it easier, we make it applicable, like in the streamline to include these templates and share it with all of you during the program. And finally, the program include the way that we will manage this patient in the long term. Obstructive sleep apnea patients are patients that will stay with you for a long time, years and years and years. So we need to establish a very strong protocol to know where, how, and what areas will be included when we see these patients at 6 months recall or once a year recall. So having mentioned all that, so these pretty much include part of our mastery program in dental sleep medicine. So this program will be offered in Hong Kong in collaboration with Hong Kong Dental Sleep Medicine Solutions, which is something that we've been working together to develop the curriculum framework to bring to all of you, an evidence-based clinical approach program that is immediately applicable to manage sleep apnea patients in your practice. And remember, sleep apnea patient is a fast-growing field. So, the topics that we include into these modules is a combination of sleep medicine, myofunctional therapy, sleep surgery. So basically the areas that we review in this short presentation and the areas that are needed to manage this patient from a multidisciplinary standpoint. So the program includes 3 modules. 2 of those modules are on site in Hong Kong and 1 module online, which we bring a series of well-recognized speakers. So the combination of hours, learning hours though, from the didactic and self-learning is a total of 65 learning hours, which we'll review and distribute into the didactic on site and also as part of the educational platform that we had from the consortium. These are the list of speakers that will participate with us. on site and online. So many of these faces, many of these names may be familiar to some of you. And, combination of expertise, from sleep, breathing orthodontics, pediatric sleep medicine, sleep surgery, ENT, practice-based research, dental sleep medicine, of course, oral appliance therapy. So all this is really going to provide a very strong learning. But in addition to the content, the academic and the evidence-based curriculum framework, so what we do with all these topics, all these different lectures, is to develop a sequence of learning, a learning curve that will guide you towards all these steps from the foundation, from the fundamentals of sleep medicine, dental sleep medicine, going towards, becoming an expert into the management of these patients. And we'll be there alongside to guide you, during the program. You will have, in addition to understanding all these steps, to develop the clinical skills in dental sleep medicine, examination, understanding the diagnostic capability of polysomnograms, home sleep apnea testing, understanding the literature review, understanding and learn how to develop the treatment planning and management of patients. So clinical cases is a way that participants who has taken our programs, many of these programs. So clinical cases is a nice way of learning, with real life cases, either these cases presented by the speakers and also cases, clinical cases presented by participants, which we will guide participants towards the development of these clinical cases presentations. And, it include, which is guidance, mentorship towards this particular area. So the learning areas is a combination of sleep physiology, medical and dental knowledge, patient assessment, patient communication, hands-on. I think hands-on workshops, it really makes a difference on this type of educational courses. So we make sure that the practical skills, the hands-on experience is there, and for all of you to conclude the program in a way that you feel confident to initiate cases, and at the same time that you will feel confidence to have somebody there for you, as a mentor. So during the program and after we conclude the mastery program, we develop some protocols, some additional activities where you will benefit from direct mentorship, to continue into managing complex situations, continue, the learning of this field. So the mentorship and the learning process, it really doesn't end with the mastery program. It's just the beginning of a lifelong learning process, having, a mentor, having a group of team members being available and to continue the journey of dental sleep medicine. So just to conclude, so these are the list of speakers ready to share their expertise with all of you. So ready and excited to along with Nestle Solutions, Dr. Jonathan Koo, and Mr. Isaac Sean, to really provide the best experience in the field, on the fast-growing field of dental sleep medicine. So now to finalize, so you may have some questions, regarding when is the program start, does the program start, how much does the program cost? So before moving into the next slide, my message is that this learning process, is an investment. It's a strong investment of time dedicated to learn from a group of experts in the field of dental sleep medicine and the field of myofunctional therapy, sleep surgery, orthodontics, pediatric sleep medicine. So that investment, it really will carry on over the management, the confidential management, sleep apnea patient, the snoring, and the component, the business component, reaching out to a new group of patients in your practice, is going to help the continue growing or your field. So for information regarding registrations, for information regarding a reduced tuition fee for groups of participants, so the contact person, of course, you can reach out to all of us. So we communicated with Hong Kong Dental Sleep Solutions, Dr. Jonathan Koo and Mr. Isaac Sean. So we decided that for those of you taking this informative webinar today, so we will continue the communication. We will reach out to you over the next few days to offer this reduced tuition fee. It's a discount that will apply for those of you taking today's webinar, and also a special discount for those of you who has a colleague, a friend who may have interest in this program, and combination of a group registration, it brings the tuition fee even lower. So this is the contact information, the email, the phone number for Mr. Isaac Sean, who is the person doing part of the hard work behind the scenes. So he will be reaching out to you via email, by phone number, whatever your preference is, just to continue giving this information, and to make sure that we answer all additional questions that you may have, and being able to see you in this program, which start around the corner. Will start in January with the on-site module, and from there, it will be a series of on-site online sessions to guide you towards this learning journey. So I would like to invite Dr. Jonathan Koo, if you say you are available, just to mention a few words, Dr. Koo, to the group, and
Yep.
any
Yep.
additional information.
Yep. Yeah, thank you, Dr. Korea. It's a very elaborated and very informative session regarding the content of the course. For me, apart from an organizer, maybe I can share some of my idea as can I call myself alumni? I didn't really learn from this setup, but I learned from Dr. Korea back, I think, like 6-7 years ago when he's still working in Boston, and we met. I learned from him from the mini residency of dental sleep medicine, and that was a hard time because we have to do all the flying from Hong Kong, Boston several times to complete the course. And now it's a very fortunate opportunity that we can bring everything from US all the way to Hong Kong. That saves us a lot of trouble. And also, I'll say in terms of the lineup of speakers, can I say it's a big upgrade, right? When compared to a few years back, it's a more comprehensive. Back then, we do not have a lot about pediatric sleep medicine and also about myofunctional therapy. But now that we have Dr. Katwa and also Rochelle, who are both the expert to further polish the content of the course, which is a big plus in my opinion. Even I have been doing this for so many years, I was still there's still always the capacity to learn more. That is number one. And number two is, I know a lot of us think, okay, the work for dental sleep medicine is making a appliance and then take an impression, take a bite, and then here go. It's part of the work, but honestly, I would believe we are somehow misguided to the thinking that it's just about making an appliance, taking a bite. From my practice, that was myself 10 years ago. I learned a little bit very, very little bit. And I think that is the answer for snoring and sleep apnea. And then it turns out it didn't work because we do not have the knowledge or the knowledge of sleep medicine behind. So that's why we're working with Dr. Correa to help to help us to start at the right step, is that we learn the big picture about sleep medicine, about sleep breathing disorder, and then we use our expertise as a dentist to help our patient, rather than just, okay, when patient is snoring, come in, take a bite, sign up for some appliance, send to the lab, and then deliver a patient. It's just not enough. That is, I mean, it may work for 1 or 2 cases, but the more you work on that, you will see the problem coming without the background knowledge. And further on is, I understand for a lot, I see there are some dentist that is not from Hong Kong, but I hope this information also applied. That is, I know it's quite a hard time for dentistry in Hong Kong these days. We have competition from China. We have an economic downturn, and everything seems to be uncertain at this moment. But as I said, it is the right time and the best time to equip yourself and upgrade your practice. It's the investment. I would say it could be in some tuition fee, but in the end, it's an investment. And you may worry there's no we don't have those kind of patient. We're not like the States who have insurance, everything. From my experience, I started all these all the way back in like probably more than 10 years ago, when I'm working on my own on a very small clinic. And I was thinking, there may not be such patient, but I still want to learn. I want to upgrade myself. I want to have a better practice and have a better care for my patients. And you know what? From my experience is, you think there is not those patients, there is not enough patient because you don't know how to find your patient, and because you do not have the knowledge to see the problem in a patient. For me, it's after I learned properly from Dr. Correa, from Boston, from the Tufts, I would say I have developed my way to finding those sleep patients in my regular dental practice. I still do regular dentistry, I still do everything, I still do implant, blah, blah, blah. But then dental sleep medicine and treatment for sleep apnea do add a very significant revenue or significant portion to enrich my practice. But the first thing, you need the knowledge to find those patients in this case. Lastly is I would like to upsell these courses. It's very commercial, honestly, but because we invite Dr. Correa all the way from US, is instead of asking people to go to the States, we want to give a local or regional component to the course by contributing myself, because I have been doing sleep. It's not a lot. I won't say I'm the expert in this field, but I've been doing dental medicine in Hong Kong for more than 10 years, and I think I have the local. So I would say we have always see something that is like not the same as other country like in US or Australia, that is quite local or quite regional. And also a lot of time we are seeing Asian patients that that probably require different treatment. So we want to add this regional characteristic to our course to better support your practice in that way, instead of like a very, very, very like general cookbook recipe style. Of course, we want you to understand what is behind. We give you some guidelines, support clinically or academically to refine your practice, to find your own way to do sleep medicine. It's not a cookbook like you have to do like Jonathan or have to do like Dr. Correa. It's not like that. It could be very versatile, very personal, and we really want to include that component in our courses by having I myself to contribute into this bigger picture. So I hope just if you have any question, you can always ask Isaac in terms of registration, or you want to reach out to me, you can also reach out Isaac, and I can always share some personal experience regarding the learning or the practice. Yeah, right. I guess, yeah, that's it.
Thank you so much, Dr. Ku. And just lastly, I'm going to share the phone number one more time, so you can take a screenshot. You can contact us either by email or directly to the phone number listed on this slide. So, as Dr. Ku mentioned, so we are here for you. Any additional questions, anything that you want to know, including, past experience from Dr. Ku's taking our programs in the past, or anything else that related to the academic component or the registration, just feel free to reach out to us, the email or the phone number, WhatsApp, phone call. So we are here for you. So we hope that today's informative session, it really motivates the desire, though, to get involved in this important area, in this important field. And we look forward to seeing you, as part of the group that we will start in January with the first module on site. And from there, it started, like a journey, a learning journey in the field, and the fascinating field of dental medicine. And we'll continue there for you, guiding you, doing some mentorship, and taking the next step to your dental practice. Thank you so much for attending today's informative webinar. Thank you, Dr. Jonathan Ku. Take your eye session,
Thank you. Thank you.
and
Thank you,
be in
everyone.
touch.